To an ongoing fight against overdoses and deaths due to overdose, and then the bigger issue of mental health in our communities. Emergency room visits due to opioid overdoses just in the last year have increased significantly. Mayo Clinic recently released their findings of just how significant the increase is and say opioid overdoses were responsible for roughly 1 in every 300 ER visits last year. The Centers for Disease Control and Prevention recorded more than 93 opioid overdose deaths just in 2020. That's a nearly 30% jump from 2019. As we know, the opioid epidemic sadly factors largely into a bigger, more broad mental health crisis in this country. So with that said, I am bringing into the broader conversation Senator Dave Senjem, who has been a lawmaker with us for many years. He is also instrumental in having spearheaded the Southeast Minnesota Regional Mental Health Crisis Center, which there was a ribbon cutting today for this center. It has been a long time coming. And the backstory to this, Senator, is back in 2016, something happened with Mayo that you thought was unacceptable. Explain that story.
Well, so we're at our Chamber of Commerce Government Forums meeting. It's a Monday morning. We do it every month, first Monday. And Aaron Sexton, who's the government relations person at Mayo, indicated as we did the roundtable that they had 12 people sleeping in exam rooms at the St. Mary's Emergency Center, which is way out of character as far as I'm concerned. That's
because of mental health issues that they couldn't let these people go.
And there's no place to put them. The Generose is closed. There's no other place to put them. And subsequently, what I found out is we started traveling the state. Well, if it's this bad in Rochester, just think what it must be other places. And counties were sending people to North Dakota and Kentucky and Indiana and things like that because there simply were no beds in Minnesota. And so that was, okay, then what do we do? And my initial idea was, let's recreate the state hospital system. Well, that's pretty big, pretty expensive. But once we kind of regained some sanity ourselves, we developed this concept of regional crisis centers, where at 3 o'clock in the morning, if frankly all hell is broken loose in your family, you really need some help, you got a place to go, other than the emergency room, which really necessarily is not designed to treat mental illness. These places are.
Not only are we talking about emergency rooms, not supposed to be housing people who are in a mental health crisis, but also we've done so much with our law enforcement, and they're there if a crime is broken. Sometimes in some of these mental health situations, a crime hasn't even been broken. Law enforcement is brought in, and these agencies, the ER, law enforcement, don't know what to do or where to take some of these folks. So
exactly.
this being so important.
So what we found out is that, I don't think this happened in Olmsted County, but far too many counties, where does a mental health patient end up? In jail. Yeah. That is not therapy at all, not even close. And so that's what we had going on, and still do to some great extent.
Talk about securing the funding. Something, a venture like this isn't cheap. So this has taken a big effort for a lot of people, and then the money. Sure.
Well, it was, as it turned out, we passed our initial bill in 2018. It was $30 million. That built 6 of these. We subsequently have, in last October's bonding bill, added 10 million more. So now we're at 40 million, and we've actually, it's actually a couple. I won't get into details, but another 3 million in there. So we put $43 million into this so far. And we'll add to this probably next session as we get into the bonding bill.
And that's the other part of this, the politics behind something like this effort. Everybody sees the need. Everybody sees how important it is, but we don't always see lawmakers agreeing on money amounts and how to go about doing this. Where's the struggle, Ben?
The struggle really was with mental health advocates that didn't believe necessarily that we ought to put people into places, that we ought to continue to treat them on an outpatient basis with pharmacologics. Now, and that's fine.
And that surprises me a little bit.
That's what we do a lot with.
Yes.
But there are patients that just need a little time to kind of stabilize, and that's what these centers are.
What have you learned that is going to happen at this center and I know that you've been kept in the loop for pretty much every step of the way, but there are some things that when it comes to an unveiling like today that you learn, it's like, didn't know that was going to happen.
Well, I think what continues to surprise me I was raised in a family that had a lot of mental health issues, mother and dad. But more recently, in today's world, if you will, it's the young people, all the way down into grade school and even younger, honestly. And so this does have accommodations for youth, if you will, if need be.
Okay, I'm going to stop you right there if I can. We're going to take a quick break. We'll come back and continue to talk about this. It's so important.
It is.
Okay, we'll be right back. I'm continuing my conversation with Lawmaker, Rochester Lawmaker, Senator Dave Senjem, who was instrumental in helping get the Southeast Minnesota Regional Mental Health Crisis Center the funding that it needs from the legislature, but as well as getting to the point of the funding happens, groundbreaking goes on, and then today with the unveiling. We were talking before the break about the need for children and how young it goes with the mental health issues for them. What kind of stories did you hear today that you thought, I didn't even know that these problems were going on?
Well, I kind of knew them because of the teachers come and visit us a lot at the state capitol. Not so much last year, but certainly the year before. Yeah. And that's where you kind of get this story. Although just seeing the place today, I mean, they have accommodations for very, very young, young children. And so maybe no surprise there. It's just, but it is a surprise in the sense that
that we've gotten to the point where we're at today.
We've gotten to the point, and a lot of these younger people, it's hard to say about their involvement in life stresses and so on and so forth. Certainly, some of the families that that some of these young children have to grow up with is maybe not the best, but nonetheless, we typically, at least in my generation, acquaint all of this with adults and. But no, it's a whole spectrum.
Does that open up things as you were hearing stories today and what's going to be available for you to start thinking, oh God, our work at the state capitol is more important than ever in that. So there's mental health, but that is such a broad umbrella. Yeah. And then you have to say, we have to give more to our teachers. We have to give more to these social workers, all different departments. It's never ending.
Oh, it is. I mean, the teachers, the social workers, the law enforcement people that are almost always first to confront these situations out in the field, they all need training. They all need familiarity with this. And it's hard because you just don't, you don't know what, at least many of these people don't know what they're going to confront when they confront it, and they've got to be able to recognize it and deal with it.
The special session is over. A lot is getting back to normal as we knew it before the pandemic. Now that you're able to sit back and actually kind of breathe without having to be at the Capitol every day and being in committee meetings, there is still stuff that's going on at the Capitol. I think a lot of people are thinking about re-election. I wanted to talk to you kind of where state politics are right now, even though our lawmakers are breathing.
Well, yeah, it's we're a year away from campaign season, absolutely, and so a lot of talk about re-election. Governor Walz, I believe, is going to run again, and then on our Republican side, who are going to be the candidates? Scott Jensen has announced. I think Senator Gazelka is going to be announcing shortly. Maybe others as well. Senator Benson has indicated, at least to me, I maybe shouldn't be so
bold as to put it out there.
That she may be a candidate, and so we'll just see how that unravels. But a lot. You're right. We're in this season now where it's time for people to start thinking about the 2022 election.
Yeah. With that said, voter integrity is a big issue, and I wanted to touch on that just a little bit and get your thoughts on. In Minnesota, how our voting went for 2020, not to talk about the presidential election and where it is now, but do you believe that it has been a fair election here in this state? Because I know that there's the Minnesota Voters Alliance taking on the Secretary of State and saying that there isn't the integrity that we need. What are your thoughts on it?
Well, we get these questions a lot. So for a couple of years, I've been an election judge myself. I wanted to find out myself. How does all this work?
Yeah.
And does it work? And is it fair? And so on and so forth. So, I have to say, Betsy, those election judges, me included, actually, we work pretty hard on that integrity issue. And I think at any given precinct, I think we were just impeccable in terms of, you know, the votes and the count and everything like that, checking against each other and so on and so forth. So I have a lot of problems believing that, at least in Minnesota, in our county at least, we don't have integrity.
A lot more is going to continue to unfold with this as we get closer to the midterm. Senator Senjem, thank you for coming in and talking to me about it.
Thank you so much. Always, Betsy.
And we'll be back.